everyone, this is Dr.Habiburrehman. Today we're going to discuss a new topic, the peptic ulcer. In this video lecture, we will talk about different things of the peptic ulcer, like we will talk about the definition of the peptic ulcer, we will talk about the risk factors of peptic ulcer, we will talk about the sites of peptic ulcer, the types of peptic ulcer, we will talk about the management of peptic ulcer, and we will talk about the clinical feature of peptic ulcer, and most important, we will talk about the role of H. pylori, the mechanism how the H. pylori cause the peptic ulcer, and we will talk about the mechanism how NSAIDs cause the peptic ulcer. So first of all, you should know that what is peptic ulcer. Peptic ulcer is a lesion in the mucosa of gastrointestinal tract, or you can say that peptic ulcer is a break in the mucosa of gastrointestinal tract. Peptic ulcer is a lesion in the mucosa, gastrointestinal tract, or peptic ulcer is a break in the mucosa of gastrointestinal tract. Remember that peptic ulcer does not mean break in the mucosa of stomach. Most of the students, they think that peptic ulcer refer to the ulceration in the stomach, but never. Peptic ulcer means ulceration in the GIT, the mucosa of GIT. It includes the peptic ulcer may occur in the esophagus, it may occur in the stomach, it may occur in the different parts of intestine. So let's have a diagram here. For example, this is mucosa. Whenever there is break or there is any lesion in this mucosa of the GIT, we call it peptic ulcer. Now we come to know what is peptic ulcer. The next we will talk about the sites of peptic ulcer. In which area of the gastrointestinal tract the peptic ulcer occurs. So remember, the peptic ulcer can occur in the esophagus, the peptic ulcer can occur in the stomach, and the peptic ulcer can occur in the duodenum, it can occur in the jejunum and Meckel's diverticulum. So let's have to talk about the risk factors. Sorry, before risk factor, I should talk about the sites, then the risk factors. Sites of peptic ulcer. It can occur in the esophagus, it can occur in the stomach, it can occur in the duodenum, it can occur in the jejunum and Meckel's diverticulum. So these are all the sites of peptic ulcer. Now let's have a diagram here so you can remember the sites of peptic ulcer. the diagram of GIT, gastrointestinal tract. So you have to know the parts of gastrointestinal tract. So you may easily remember the sites of peptic ulcer. For example, this is esophagus, the stomach, and then we have small intestine. The small intestines have three parts. The first part is called duodenum, the second is called jejunum, and the third part is called ileum. So the first part, duodenum, jejunum, and ileum. So now you can easily remember the sites of peptic ulcer, like it can occur in the esophagus, it can occur in the stomach, it can occur in the duodenum, it can occur in the jejunum. Now we will talk about the Meckel's diverticulum, that what is Meckel's diverticulum. So now we will talk about the Meckel's diverticulum, that what is Meckel's diverticulum. Meckel's diverticulum, it is a congenital abnormality. There is a slight bulge in the small intestines. It contains the mucosa is present in gastrointestinal tract. What is Meckel's diverticulum? It is a congenital abnormality, or it is a developmental abnormality. There is a slight bulge in the small intestines, and this bulge contains the same layers or the same mucosa which is present in the gastrointestinal tract. Let's have a diagram so you will understand it. For example, this is small intestines. This is a segment or portion of small intestine. So in this abnormality, there is a bulge. There is a bulge in the small intestine. This part is called Meckel's diverticulum. And as I told you, it is called true Meckel's diverticulum because it contains the same mucosa is present in the gastrointestinal tract, so it contains same layers and same mucosa. So one of the site is Meckel's diverticulum. Now you have the concept of Meckel's diverticulum. After the site, I will tell you some important points about the sites of peptic ulcer. So the first important point is about the duodenum. Remember that from 90 to 95% of the peptic ulcer occurs in the first part of duodenum. First part of duodenum. This is very important point. Another important point about the stomach, 90% of stomach ulcer occurs in the lesser curvature. What is lesser curvature? What is greater curvature? This curvature of the stomach is called greater curvature, and this curvature is called lesser curvature. So 90% of the stomach ulcer occurs in the lesser curvature. About the esophagus, the ulcer in the esophagus occurs in a disease which is called gastroesophageal reflux disease. So you should know it occurs in the gastroesophageal reflux disease. And another point about the jejunum, that the ulcer of jejunum occurs in a disease is called Zollinger Ellison syndrome. Let's have a review. First of all, we talk about the peptic ulcer. Peptic ulcer, I told you, is a lesion or break in the mucosa of the gastrointestinal tract. Then we talk about the sites of peptic ulcer. The sites include the esophagus, stomach, and parts of small intestine like duodenum, jejunum, and we talk about the Meckel's diverticulum. Meckel's diverticulum is a congenital abnormality in which there is a slight bulge of a small intestine which contain the same mucosa is present in the gastrointestinal tract. So the peptic ulcer can also occur in the Meckel's diverticulum. And then we talk about some important points. About duodenum, we talk that 90 to 95% of the ulcer occurs in the first part of duodenum. About the stomach, I told you that 90% of the stomach ulcer occur in the lesser curvature. And then I talk about the esophagus ulcer, which occurs in the gastroesophageal reflux disease. So now we will talk about the risk factors. So after that, now we are going to another portion of this video. The risk factors. Risk factors means what are the etiology. So the etiology includes NSAIDs, H. pylori bacteria, smoking, and sometimes hereditary. Here we will talk in detail about the H. pylori and NSAIDs. So let me write the risk factors. It includes H. pylori bacteria, NSAIDs, smoking, and hereditary. These are all about the risk factors, and now we will go in detail of the NSAIDs. NSAIDs are the drugs which are simply called non-steroidal anti-inflammatory drugs. So there are two mechanisms in which these NSAIDs or these drugs causing the peptic ulcer. So mechanism number one, these drugs are cytotoxic to epithelial cells, and these drugs destroy the mucosal barrier. Let's see this diagram. This is epithelium, and above the epithelium there is a phospholipid and glycoprotein layer, or which is called mucosal barrier. So these NSAID drugs destroy the mucosal barrier, this one, and is cytotoxic to the epithelial cells. So when they destroy these things, ultimately they will lead to the peptic ulcer. This is one of the mechanisms. And one thing I should tell you, that NSAIDs are the most important etiological factor in the stomach ulcer. 30% of stomach ulcer is caused by NSAIDs. Now we will talk about the second mechanism of NSAIDs, that how it causes the peptic ulcer. Mechanism number 2. There are two enzymes, COX-1 and COX-2. The COX-1 enzyme produces prostaglandins at the gastric mucosa. COX-2 enzyme produces prostaglandins at the site of inflammation. These prostaglandins, which are produced at the gastric mucosa, perform the two functions. First, it increases the mucosal defense, and it decreases the acid synthesis, acid production. And these prostaglandins produced by COX-2 at the site of inflammation causes inflammatory reaction. This is normally, now when we give the NSAIDs, most NSAIDs, there are different categories of NSAIDs. One is non-selective, one is selective. So non-selective are those NSAIDs which inhibit both the enzyme COX-1 and COX-2. So if we give the non-selective NSAIDs, so it will block or it will inhibit both the enzyme COX-1 and COX-2. So when this enzyme is inhibited, there will be no production of prostaglandins at the gastric mucosa. So there will be no defense, there will be no mucosal defense, decreased mucosal defense, and there will be no reduced in the acid production. So what will happen? Ultimately, it will cause the peptic ulcer. And COX-2, when it blocks the COX-2 enzyme, there will be no production of prostaglandins at the site of inflammation. So there will be reduced in the inflammatory reaction. That's why they are called non-steroidal anti-inflammatory drugs. Let's review what we talked. NSAIDs causes the peptic ulcer, one of the risk factor. There are two mechanisms in which the NSAID causes the peptic ulcer. Mechanism number 1, these drugs are cytotoxic to epithelial cells and they destroy the mucosal barrier. So it will lead to the peptic ulcer, and 30% of stomach ulcer are caused by the NSAIDs. Mechanism number 2, the non-selective NSAIDs will block both the enzyme COX-1 and COX-2. So when COX-1 is blocked, there will be no production of prostaglandins at this gastric mucosa. So there will be no mucosal defense, there will be decrease in the mucosal defense, and as the inhibitor is not produced here, so there will be acid production and it will lead to the peptic ulcer. And the COX-2, when it blocks the COX-2 enzyme, there will be no production of prostaglandins at the site of inflammation, and there will be inflammatory reaction. And one important point about the NSAID, you should know that most ulcerogenic NSAID is aspirin. We will talk about the H. pylori, the mechanism how H. pylori cause the peptic ulcer. But before the mechanism, I should tell you about the structure of H. pylori and the virulence factor of H. pylori. So H. pylori, I will draw a diagram. H. pylori is a gram-negative rod bacteria. It contains flagella, multiflagella. It contains lipopolysaccharide molecules on the surface. It contains an enzyme on the surface, very important, urease enzyme. It contains a circular DNA inside. And H. pylori produce two types of exotoxin. One is called KEG-A, one is called WEG-A. So these are flagella. These molecules, lipopolysaccharide molecules, they are called adherent molecules because it helps in the adherence. These are urease enzyme on the surface, circular DNA, and releases two types of exotoxin, KEG-A and WEG-A. So about H. pylori, it is a gram-negative. It has flagella, multiflagellas for the moment. It has adherent molecules which help it in the adherence, in the attachment, and it has urease enzyme on the surface. It releases or produces two types of exotoxin. One is called KEG-A, another one is called wake A. Now what is the function of cake A and what is the function of wake A? Cake A disrupt or destroy the cellular integrity and causes the inflammation, promote the inflammation, and wake A causes the apoptosis of cells, epithelial cells. Now very important in all these features, the important one is urease. Urease enzyme help in the survival of the H. pylori. How it is important, so you should know that this urease, before going to explain the mechanism, I should tell you that normally in the stomach there is high level of HCl, which is acid, so bacteria cannot survive there. But H. pylori is the bacteria which can survive in the acidic environment. But how it survives, there is a special mechanism which I am going to explain you because of the urease enzyme which help in the survival. How? This urease enzyme will convert ammonia and water it will convert urea and water into urea, ammonium and carbon dioxide plus ammonia. See once again, this is urea, this is water. This urease enzyme will convert urea and water into carbon dioxide and ammonia. Ammonia is alkaline in nature, basic in nature, so it will neutralize the acidic environment. It will neutralize the acidic environment and will make the environment suitable for the survival of H. pylori. So let's have a review. We are talking about the H. pylori. H. pylori is a gram-negative rod. They contain flagella which help in the movement of bacteria. It contains the circular DNA. It contains on the surface it contains lipopolysaccharide molecules which are also called adherent molecules which help in the attachment. It contains urease enzyme which help in the survival of H. pylori. They release two types of exotoxin, KEGA and VEGA. The function of KEGA disrupt the cellular integrity and causes the inflammation. VEGA causes the apoptosis. How urease work? Urease enzyme convert urea and water into carbon dioxide and ammonia. This ammonia is alkaline in nature. It neutralizes the acid and make the environment suitable for the H. pylori bacteria. To know the structure of H. pylori bacteria, now we will go to the mechanism how this bacteria causes the peptic ulcer. Let's draw a diagram of the gastric mucosa. The GIT is lined with the columnar epithelium, and above the epithelium there is mucosal layer. This is mucosal layer. This one is columnar epithelium, and at the top there is HCl or acids, HCl, and this is the lumen of stomach. In the lumen there are H. pylori bacteria. I draw the diagram. The GIT covered with the columnar epithelium. Above the columnar epithelium there is mucosal layer, and above the mucosal layer there is acid HCl layer, and in the lumen of stomach there are H. pylori bacteria. Normally these H. pylori bacteria have no access to the epithelial cells because there are HCl layer, there is mucosal layer between the H. pylori and epithelial cells. So this H. pylori bacteria, as I told you, contain the urease enzyme, and this urease enzyme convert urea and water into carbon dioxide and ammonia. This ammonia is alkaline in nature, so it will neutralize the acidic layer. Whenever this ammonia will neutralize the acidic layer, so the bacteria will have access to the epithelium. This layer will be neutralized. So bacteria H. pylori will have access to, with the help of flagella, they will come down and they will be attached with the epithelial cells. With the help of adherent molecules, they will attach to the epithelial cells. Now, once they attach with the epithelial cells, they will release two types of exotoxin, KA and WAK-A. They will release KA and WAK-A. Now this KA, it will destroy the cellular integrity and it will release interleukin 8, which will attract the macrophages and will cause the inflammation. Whenever the cell integrity is lost and the tight junctions between the epithelial cell is lost, and when this WAK-A cause the apoptosis, here a gap will be formed between the epithelial cells. a break will be formed or a gap will be formed. So now let's suppose here the gap is formed, the HCl layer, the acidic layer will have access down, will have access down to form the ulcer. Let's have a review. We are talking about the mechanism how H. pylori cause the peptic ulcer. This is columnar epithelial layer, this is mucosal layer, and this is acidic HCl layer, and in the lumen there are H. pylori bacteria. Normally this H. pylori bacteria have no access to the epithelial cells because there is layer between the bacteria and columnar epithelium. Whenever H. pylori convert urea and water into carbon dioxide and ammonia, this ammonia is alkaline in nature, it will neutralize the acidic layer, it will neutralize the HCl layer, and now the bacteria, when it neutralizes the layer, will have access to the epithelial cells, and when it attaches to the epithelial cells with the help of adherent molecule, it will release two types of exotoxin, KA and VEGA. KA will destroy the cellular integrity, and VEGA will cause the apoptosis. So the cells here will be killed, and the acids HCl will have access down, which will cause or which will form the ulcer. So after H. pylori, now we will go to discuss another risk factor, smoking. Is very easy. Smoking, it increase the risk of recurrence. It reduces prostaglandins synthesis, and prostaglandins help in the mucosal defense, so it reduces prostaglandin synthesis. It causes the impaired mucosal defense. It will decrease the blood flow, and it may increase the acid production. So all by these mechanisms, ultimately they will lead to peptic ulcer. So it causes the risk of recurrence, increase the risk of recurrence, it reduces the prostaglandin synthesis, it causes impaired mucosal defense, it decreases the blood flow, and it increases the acid production, and ultimately leading to the peptic ulcer. Now we discussed the definition of peptic ulcer, the sites of peptic ulcer, the risk factors. We talked about the mechanism how insect cause the peptic ulcer. We talked about the mechanism how H. pylori cause the peptic ulcer, and we talked about the smoking, which is one of the risk factor. The remaining things about the peptic ulcer you can watch in the next video. Keep on watching Easy to Learn Production.